Hello everyone, my name is Christy. I am a new grad nurse. I graduated last spring of 2023. I've been a nurse for like 5 months. I don't really have much experience, but I will let you guys know how my own belief, values, and self-knowledge has helped me so far in providing competent nursing care. I have good story and a bad story. I'm gonna try to make this as quick and good as possible. Okay, so when I first started being a nurse, like as a nursing student, especially when I took health assessment, I was learning how for your belief and your for you to understand your patient's beliefs, you have to know of your own beliefs first. So I learned about it, but I've never really put it into application. So at the end, what I realized is that it's not just about me, it's all about patient care. So I have to know what I know, so I know my lines and my borderlines, so I don't go and try to convince my patients otherwise. Because I normally had that thing in me where I would like, if I think this is what you should be doing, if I think this is what is right, and you should be doing what I think is right. But as I started working as a nurse, I started putting that into application, like be quiet down and listen to what they have to say, listen to what they believe in, and that has helped me a lot in patient care. So I learned that you have to know your own belief, which is what I am still in the process of learning, my own beliefs, my own values, into applying that into nursing. So I'm in the process of doing that. It's not the best yet, but I'm in the process. So I have a story. I had a patient. I went in the room. I'm trying to I was interacting with him. As I was interacting with him, I started teaching him regarding his stuff, his blood pressure medicines that he was taking, anticoagulants. And then he got mad. He was like, I don't want to talk to you right now. And I believe all of this is like, it's not true, it's not right, I shouldn't be taking the medicine. And I'm trying to convince him, like, you need the medicine for this, like. And then it occurs to me, he was really agitated, like he was mad. He told me to get out of the room. I got out of the room. But throughout the day, I started to think, I was like, that's like what I believe in. Other people might believe that it's not good, like for them to have the medicine, they'll do fine without it. And the patient was alert and oriented. So at the end of the day, I took it to my charge nurse and I told her, and she was like, yeah, Christy, like you cannot force your own belief on the patients. And then that's when I went in later on that day. I was talking to him, I was explaining. He was like, yeah, I understand that's why you think it is. I don't believe in it, but I will still take the medicine. So it went from like a big story, me trying to convince my belief on the patient, but at the end of the day, like he still did what I wanted him to do, but he's like, I just wanted you to know I don't believe in it, but I'm still gonna take the medicine. So like that's one way that I've learned not to put my own belief on people. So what I normally do now is like, especially upon admission or when I first interact with the patient, like I try to make myself aware of my own belief, and when I talk to them, I try to talk like in general, like that's what other people would do. And then like I try to get their opinion, like what would you do in a situation like that, like do you believe in this, do you really, like what do you believe in? And that has helped me a lot into providing competent nursing care, and I've been doing much better since I started being on my own for like 2 months now. Like I was saying, I don't really have much experience, but this is about it for me. Thank you.